I've just received another briefing from a great group of talented people on the virus that is going around to various parts of the world. We have, through some very good early decisions that were actually ridiculed at the beginning, we closed up our borders to flights coming in from certain areas, areas that were hit by the coronavirus and hit pretty hard. And we did it very early. A lot of people thought we shouldn't have done it that early, and we did, and it turned out to be a very good thing. And the number one priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. As most of you know, the level that we've had in our country is very low, and those people are getting better, or we think that in almost all cases, the better are getting. We have a total of 15. We took in some from Japan. You heard about that, because they're American citizens and they're in quarantine. And they're getting better too. But we felt we had an obligation to do that. It could have been as many as 42. And we found that it was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're recovering. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered. 1 is in the hospital, and 5 have fully recovered. And 1 is, we think, in pretty good shape. And it's in between hospital and going home. So we have a total of, 15 people, and they're in a process of recovering, with some already having fully recovered. We started out by looking at certain things. We've been working with the Hill very, very carefully, very strongly, and I think we have very good bipartisan spirit for money. We were asking for $2.5 billion, and we think that's a lot, but the Democrats and I guess Senator Schumer wants us to have much more than that. And normally in life I'd say, we'll take it. We'll take it. If they want to give more, we'll do more. We're going to spend whatever's appropriate. Hopefully we're not going to have to spend so much, because we really think we've done a great job in keeping it down to a minimum. And again, we've had tremendous success beyond what people would have thought. Now, at the same time, you do have some outbreaks in some countries. Italy and various countries are having some difficulty. China, you know about where it started. I spoke with President Xi. We had a great talk. He's working very hard, I have to say. He's working very, very hard. And if you can count on the reports coming out of China, that spread has gone down quite a bit. The infection seems to have gone down over the last 2 days. As opposed to getting larger, it's actually gotten smaller. In one instance where we think it's somewhat reliable, it seems to have gotten quite a bit smaller.